at that time, I was already doing a lot of like guest lectures at UGA. I started doing guest lectures at Spelman on breastfeeding to different classes. And so I wanted to continue that work. And so that was folded into Breastfeeding Club as well. Over the years, I've expanded to do webinars with different organizations as well. And then more recently, I would say within the last few years, I've developed partnerships with other organizations based on like the alignment of like the goals of Black Girls Breastfeeding Club and their alignment, which is usually Black maternal health. And so I've been able to work with different organizations, either as a board member or as a kindred partner or collaborator, like with Black Mamas Matter Alliance, and then also consult on different projects that are surrounding research related to Black maternal health.
This is the Public Health Millennial Career Stories podcast, where you'll hear about diverse career stories, career strategies, get tips, and learn from others to help you in your public health career journey. If you want to learn about public health careers, or just hear public health stories, stay tuned because you won't want to miss this. Welcome to the Public Health Millennial Career Stories podcast, episode number 82. Everyone, Omari Richards here. Thank you all so much for joining me. If you have not as yet, be sure to follow me on Instagram at the PH Millennial. If you have not subscribed as yet, I don't know what you're doing, but be sure to subscribe, leave a review, leave a like, share with a friend. Like greatly appreciate it if you share with a friend. Like literally take the link from the show and send it in a text message to 5 of your friends who you think will get value from not only this episode, but other episodes as well. I will greatly appreciate that. You can support me on buymeacoffee.com/the PH Millennial or the phmillennial.com/support. Today's episode, greatly appreciated. I think there's a lot of a booth of knowledge on there, and I really enjoyed this person's story, not only on the evaluation side, but how they started their business and the app that they're working on. And I think a lot of you all are interested in maternal and child health, so definitely tap in with this person afterwards if her story and everything that she's doing resonates with you, because I think it's awesome, and she's going to continue to do awesome things. So yeah, I hope you all enjoy this episode. See you all next week. Today, we have a public health researcher, evaluator, and maternal and child health advocate with over 10 years of experience in developing initiatives and conducting research, as well as program evaluation related to public health programs, health communication campaigns, and education. She got a bachelor's degree in biology at Spelman College before going on to get her Master of Public Health at Morehouse School of Medicine. She then went to work for a few positions before getting her PhD in health promotion and behavior at the University of Georgia. She founded Black Girls Breastfeeding Club, LLC, and bEarth Work app in 2016, and currently works as a program evaluator at the Centers for Disease Control and Prevention. We have Dr. Ayanna Robinson, PhD, MPH. Welcome to the show.
Thank you. Thank you so much for having me.
It is my pleasure. I'm very excited to dig into more of your work, and especially like the Black Girls Breastfeeding Club and how all of that came about. This is exciting for me. So how are you doing, and tell me how you've been coping during the pandemic?
I am doing well overall. And during the pandemic, I think things have gotten, at least for me, a lot better over the last few months, just with things being more open and the vaccine being available and more people being vaccinated. But overall, my family has been well and healthy. I've coped really by spending more time outside because outside in nature, of course, remained open. So a lot of running, a lot of nature walks. And so overall, yeah, no complaints. I've been blessed and healthy. So.
Well, we are happy to hear that, and we are happy that you're able to get outside. I feel like that's definitely a theme that a lot of people have picked up on, definitely making time and ensuring that there's time to get away from screens and just enjoy nature and all the wonders that it brings with that.
Exactly.
Yeah. So tell us, how do you identify, and then tell us a little bit about your personal background.
I identify as she, hers, And my personal background, well, a little bit, I'm from Cincinnati, Ohio originally, but I live in Atlanta. As you stated, I went to Spelman College and graduated in 2007. So I've lived in Atlanta for about 18 years at this point. So this is where I consider home, even though Ohio will always be home. I'm a mom. I have a 14-year-old daughter. And most of my work that I think we'll get into today was inspired by becoming a mom at the time where I was really just learning about public health and starting my public health career.
Okay, awesome. And yeah, we'll definitely jump into that. And thank you for sharing a little bit about your personal background. And you're saying that you were getting outside and doing things outside. And I know that you, like prior to this, when I was trying to get you scheduled, we couldn't get you scheduled because you went to the American Public Health Association conference. So I just wanted to give you some space to talk about how that was. I know that was a hybrid. I think it's the first time they ever had a hybrid. Well, a hybrid, and I don't know if it's the first time they ever had. No, it's definitely not the first time they had a hybrid because they had a hybrid 2 years ago. But anyway, I wanted to share about your experience at the APHA conference this year.
Yeah, so I think last year it was completely virtual. And so this year, and I didn't attend last year, I was at I kind of go back and forth between the American Evaluation Association conference and presenting there and APHA. And then sometimes I do both in the same year. But this year I attended APHA and presented there. And it was still a strong conference. APHA is probably my favorite conference to attend as a public health professional, just because it is diverse in terms of the topics. And it's a really large conference. I think you get the most out of it, at least in my opinion, when you go through the sections that you're interested in or the sections that you're a part of, and you map out all of the presentations that you want to attend beforehand, because otherwise I hear a lot of people saying because it's so broad, it can be overwhelming. But I enjoyed it this year. Coincidentally, a lot of the sessions that I wanted to attend were virtual. So I didn't have really an opportunity outside of my own session, which was in person, to attend any in-person conference. I would say overall, it still went well. I did some nice networking. It was a bit smaller, I think, than previous years, understandably because of the hybrid option and because we're still in the pandemic. But overall, I would say it was a successful conference.
Okay, well, I'm glad you went and you showed up for all of us that didn't go. We appreciate that. So before I ask you, what does public health mean to you, so that you were able to present at this conference, do you want to just give a 1 minute, 2 minute overview of what you presented about?
Sure. So I served as a qualitative research consultant for the National Birth Equity Collaborative. And particularly, I supported a project called the Maternal Telehealth Access Project. And in the role that I played, there were listening sessions conducted last fall with Black women and birthing individuals, and also Black birth workers, so doulas, midwives, and other healthcare providers. And the listening sessions were to better understand how Black women and birthing individuals received maternity care during the pandemic, and also how Black birth workers, what was their experience like in providing maternity care during the pandemic to Black women and birthing individuals, all via telehealth, I should add. And so what we presented on was the findings from the listening sessions with both Black women and birthing individuals and also the birth workers. Again, how is care being provided to this population via telehealth? What are some of the advantages? What are the disadvantages? What are their thoughts on how we can improve telehealth services to this population moving forward? And so it was interesting to work on the project, and we're working on a paper now so we can further disseminate the findings, because as you probably could imagine, telehealth is only going to continue after the pandemic. And so making sure that this population has equitable care and equitable access to care and services, considering that it's a population that already has disproportionately worse maternal health outcomes, is really important when considering providing telehealth. So I learned a lot. There are advantages, and then certainly there can be some disadvantages to providing maternity care through telehealth as well.
Yeah, I can only imagine that. And I was going to follow up on that same vein that you followed up, like telehealth and the combination of this has created a lot of opportunities for us to reach populations that we probably couldn't have reached, or like just create access points. But at the same point in time, birthing work is very interpersonal, and getting over those types of challenges is definitely going to be important, but there's a lot of potential and opportunities for the type of work going forward. So thank you for I guess, being one of the pioneers in starting this work and continuing it to go forward. We greatly appreciate that. So tell me, what does public health mean to you?
Public health is, I always think first, is all about prevention, whereas other aspects of medical care and health are focused on the treatment. Public health is prevention, and it could be anywhere from tertiary or primary to secondary to tertiary level prevention, but the focus is population level, and also protecting the health of populations. And that's not just the physical health, but also the mental, the emotional, the spiritual health as well.
Okay, awesome. Well, thank you for sharing that, and we like that perspective. And yeah, I feel like public health prevention and all the different aspects where you look at prevention, and it is a focus on that. And I know in society at large, there is not as much of an emphasis on public health as public health people would like there to be. But hopefully, with the pandemic and everything stirring up there's a better pathway for more preventative work going forward. So I appreciate you sharing that. So you got your bachelor's degree in biology at Spelman College. So tell me, what was the thought process for you going into this degree, or going into undergrad as a whole?
Yeah, that's a great question. So I would say that growing up, I was interested in science. I have always loved math and science. In my household, my dad is a physician. And so I was naturally like surrounded by medicine and did science programs growing up. And so as someone who loves science, I think at that time, public health wasn't really a field that was widely known. And so the thought process is, you love science, you like health, you would be a physician. And so I entered undergrad as biology pre-med, and pretty much growing up thinking that the physician route was going to be my career. And I loved my undergraduate courses in biology. And it actually wasn't until later, like my senior year, where I became more exposed to research, including public health research, and started to broaden my perspective a lot as far as what I could do as someone who loved biology, but also loved health more broadly, and was more interested in like community level health, developing programs, the research aspect, really understanding why people made or did not make certain decisions about their health behaviors and how we could influence those behaviors. So later in my years at Spelman, I'm pretty sure it was my senior year, actually, I was taking a course, and my professor, who became one of my mentors, was also a doctorate in public health, was a teacher at Morehouse School of Medicine. I was doing biomedical research at Morehouse School of Medicine at the time. And her course, I would say, really opened my eyes to public health and the possibilities of this type of work. And so I would say after that, it was history. I decided that I would get my MPH, and I received my MPH at Morehouse School of Medicine. And actually during that time, I was still thinking about med school. I was like, okay, I'll do my MPH and then I'll go to med school after that. And I would say it wasn't until my first like full-time fellowship after my MPH is where I discovered evaluation and my love for evaluation. And I'm like, oh, it all makes sense. Like, this is actually the type of work that I love. I still get the people one-on-one interaction with stakeholders. I'm still getting to do research, but evaluation is very applied. And so it's not research, which is also important for the sake of like furthering the science, but you can take your results and you can directly apply it to the program to improve the services and the outcomes for the population that they're serving. So yeah, I feel like it was kind of it was just me following opportunities really, and seeing where different things led me. And I'm, yeah, so happy that I landed on public health, and specifically like my work in program development and evaluation, because it's definitely like my passion area as far as the type of work that I like to do in public health.
Okay, well, yeah, I think that story is not unfamiliar with us. I also did
Yeah.
biology pre-med, hoping to become a physician. So as many other people that I've had on this show, and I think it's like important in the sense that yes, the biology pre-med gives us that direction of wanting to go and like helping people in a health-wise kind of focus. But I'm
Mm-hmm.
also glad that you got like that public health experience, exposure to someone that had their doctorate in public health, because
Yeah.
I never got that. And I think we need more of that, because it's not a field, as you said, especially probably back when you were thinking about public health, there's even less
Mm-hmm.
so a field that's spoken about. So I wanted to bring you back to that point. So you're doing biology, you're going through these classes, and then you reach your senior year. And was it that you saw your professor had a PhD that was related to public health, or was it that you went into a lab with research and the research was like public health research related type stuff? How did that work out?
So my research was more biomedical. I was exploring like different options my senior year, and there was a program called MBRS RISE Research Initiative for Scientific Enhancement that you could participate in at Spelman. And so the particular research that I was conducting was examining how a high protein diet affected inflammation in transgenic sickle cell mice. So it's very like laboratory research, not really public health at all. But as a part of the RISE program, we had monthly presentations from speakers. And so we had people to come in and talk about their research, including like public health research. So that was at one point where I was like, oh, okay, this is interesting. And then my professor spoke a lot during our class. It was called the Sojourner Syndrome. And so she spoke a lot during our class about her personal research that she was doing around Black women's mental health and how that affects different chronic disease outcomes. And I had the opportunity to explore different things that I was interested in, like nutrition and obesity, and how diet related to chronic disease outcomes as well. So it was really like in her class and having the opportunity to actually explore like what public health looks like as far as like creating projects and creating research, and hearing a lot about the work that she did, where it was almost, I could say, a light bulb moment where I was like, this is actually like, this is like the blueprint of what I'm interested in.
Okay, I like that a lot. And I think it just goes to show like exposure to public health, or just to things in general, is so important to us, like learning and absorbing and wanting to do a lot of things in life. So I'm glad that you
Yeah.
got that experience, and I'm glad that we're getting your story on this podcast so you can share more of that experience, and hopefully more people going down that pre-med route who aren't really fit or like not suited, or they'd be better off not in a physician role but in other public
Yeah.
health, population health roles, get to hear this and get to change their trajectory earlier on and just delve more into the public health field.
Yeah. And I could remember actually, I mean, like I said, during that year, I was exploring all options. I knew that I liked research. So I even at one point thought, well, maybe I'll do MD, PhD. And I could feel myself like moving less away from like the desire to do like patient care in that way, and more of like, oh, I actually like, you know, this research stuff. But I didn't necessarily want to do research in the lab with mice. I wanted to more so like do research like with people in the community. Yeah, so I think the more you can take advantages of different opportunities. I even shadowed like physicians, family medicine physicians. So, you know, I would say take advantage of all of the opportunities, especially when you're in undergrad and you're in that stage, because I mean, you have all these opportunities like right at your fingertips. And that's really helpful in deciding like, okay, this may not be for me, but you know, I'm gonna explore this option over here a little bit further.
Absolutely, absolutely. And I think that's a great takeaway and great insights, especially for undergrad students, is like get your feet wet with as much as possible, because you really don't know what you want, especially
Exactly.
going into undergrad. You're still like 18 for the most part. So yeah, appreciate that. So you graduated from Spelman. Were you so you graduated from Spelman. When you took this class and got introduced to public health, was it like, okay, I'm going to do my MPH, or okay, I still want to be a physician, but I'm not too sure about that, so let me do an MPH while I think about that? Or how was that process like for you?
It was, oh, I'm going to do my MPH, because I had always thought of like the MD in combination with another type of degree, just because I did like the idea of being able to do research and like programs. And so I started Morehouse School of Medicine like, oh, I definitely want to do my MPH, but I'm also going to do my MD after this. Like that is where I was actually. And like I said, it wasn't until my first full-time job after my MPH, which was in Maryland, I was working as a program evaluator for the Army Institute of Public Health. And that's when I was like, I don't want the MD. Yeah, coming from that, I was like, this suits me. Like, this is what I like. This gives me, like, it checks off all of like the check boxes on the type of career that I would want to have. And so it was at that point where I started thinking about the PhD instead. And I was like, okay, I think I'm not even, I know that the MD is not where I am. And that the public health fully PhD is more of like where I feel is aligned with my skills and like career goals.
Okay, and I just want to ask a quick question, and I'll come back to this later on. So the program evaluation role at the Army Institute was your first job after your MPH?
I had like a very short ORISE Fellowship at CDC. I was working in the Office of Smoking and Health, but it was like a summer position. And so, I think it lasted a little bit longer than the summer actually. And then I was looking for new positions. Actually, I was introduced to the ORISE position, which is the fellowship at the Army Institute of Public Health. I was introduced to that position at APHA. So the networking at APHA is really great. So that I would say was my it was full job. It wasn't just like a summer job. Yeah, it was my first real position, I would say, after my MPH.
Okay, thank you. And you got your MPH at Morehouse School of Medicine. Did you have a concentration at this time?
I did. It was health education and health promotion.
And what was the thought process behind that?
You know, there were a few different options at that time. Morehouse School of Medicine has moved more towards like a generalist degree in MPH, but you could have a concentration in global health, policy, and then HEHP, the health education and health promotion. And so looking at the coursework that was a part of the health education and health promotion, like I said, I'm more interested in that health education, understanding like how we can improve health behaviors, changing health behaviors. So that was definitely like the best fit for me.
Okay, that makes a lot of sense. And then did you have like any other takeaways that you wanted to share about your time during your MPH program?
Seems like so long ago. What I truly appreciated though in my MPH program is the strong foundation I received in health equity and community work. So again, very much aligned with the type of work that I love to do in public health, community-based work, focusing on health equity, ending disparities. The foundation that I received there as well was really strong in developing programs using theory. So learning about all the health promotion theories and also evaluation. So we were required to take a full year of evaluation in that concentration of health education and health promotion. So that was really like my first introduction to evaluation. I was like, oh, this is pretty cool. Again, it's research, but it's more applied. You get to talk to people and do interviews and focus groups to like interact with a variety of stakeholders. So again, for me, it's always been about, I guess in school, like getting all the skills and experiences as possible. And I think that during that time, those 2 years at Morehouse School of Medicine, I picked up a lot of skills that gave me a very strong foundation in the public health work that I do today.
Okay, well, that is great. And yeah, I think like, especially when I'm talking to people who don't know what they want to do, I'm like, well, pick up some skill sets that are going to be relevant to anything, program evaluation.
Exactly.
Yeah,
Yeah.
I think it's so important that
Yeah.
especially in public health, because there's just so much that you can do, so many different paths that you can take.
Mhm.
Getting those like essential skill sets and really being grounded in it is hugely important to everything that follows in your career.
Yeah. And it was also, so it was the first time that I really stepped into the maternal and child health path as well. And so that was my foundation in breastfeeding research as well. My Master of Public Health research was focused on breastfeeding, along with my dissertation research. And so, yeah, it's definitely like my foundation in public health and where I got a really solid start at the work that I'm doing today.
Okay. Okay. And then I'm going to take you back to a conversation that I'm thinking might have been difficult for you to have. Your dad's a physician. You a wonderful young professional growing up, and you're like visioning this physician route, and then now you're doing like masters of public health, and I'm guessing you're thinking to yourself, okay, I don't really want to do this physician route as much as I thought I did before, maybe
Yeah.
PhD. What was that conversation like? Just to help other people, because I 100% sure that other people have the same, or they have to have the same type of conversation with their parents or their dad or mom.
Oh yeah. So that was a challenge for me. And it was actually more of a challenge for me than it was for my parents. They were very supportive. I was living in Maryland at the time, and that's when I was working for the Army Institute of Public Health. And I was actually taking Kaplan. I was taking Kaplan courses, preparing for the MCAT, and I'm just like, my heart just is not in this. And I felt like I was having these like internal like struggles, because here I am, literally my whole entire life. Everyone has thought of me as Ayanna will be the physician. She's the one following in dad's footsteps. And again, that was also what I wanted. I loved health and the thought of medicine until I learned about public health. And so it was a challenge, but again, it was more of a challenge for me. And when I told my parents, they were completely supportive. And so I think sometimes we put a lot of pressure on ourselves to live up to other people's expectations. But at the end of the day, like, we have to do what's the best for us. And my parents, again, were supportive. And I think in most situations, people probably don't want to disappoint their parents or feel like they're disappointing their parents, but our parents, they love us. So they'll support you. Absolutely. Follow like what is best for you in terms of career, because yeah, you don't want to be stuck in a career for any amount of time and then later have regrets and wish that you had taken another route. So I'm definitely glad that I decided that wasn't for me. And just keeping in mind, I think one of my biggest lessons at that time was, hey, it's okay to change your mind. Like, things change, your perspective changes, your experience, all these things shape us. And it's really okay to change your mind at any point.
Absolutely. Changing your mind is a superpower, as I tell people all the time, because you can't have the same thought process that you had at 15, when you're 25, when you're 35, when you're 45. You got to evolve as you continue to learn, and changing your mind is a strength. And I think especially in today's world, people they're like, oh no, I did my research. This is the truth. This is the only truth. And they just stick to things. But I think that is harmful in a lot of ways, because as we know, science changes.
Yeah,
Perceptions of things change, and we need to be able to be able to mold and change and work with community, or work with whoever it is to really move forward, work with ourselves to move forward on those things. And
absolutely.
I also wanted to ask, because you said it was more tough on you than it was on your parents. What were those like thoughts going through your mind? Was it like, oh no, I'm like giving up on this, or like what was that thought process for you?
Yeah, it was a lot of feeling that they would be disappointed and me not wanting to disappoint my parents. And I feel like that's something that a lot of people, especially young people, can relate to. You want your parents to be, of course, like proud of your accomplishments. So yeah, I remember feeling like, oh, I don't really want to do this, but I don't want to disappoint them. And looking back, I was like, oh, it's so silly. I was putting myself through all of this torture almost because I was just not interested in the MCAT and that Kaplan course at that time. And I was like, I could have just told them earlier. And I remember the exact moment, told my mom they were in Atlanta to visit. And we were at breakfast and I'm just like, I don't want to go to medical school anymore. I actually want to get my PhD in public health instead. And she was like, it was like nothing. I'm like, she was happy. She was completely like, she was like, whatever you want to do. Like, we're proud of you, whatever you want to do. Yeah, so.
That's important to know because we put these perceptions on in our lives on things on how they're going to go, and like you're like, oh my god, they're going to get so upset with me or whatever the case might be, and like, oh yeah, that's fine. Once you're happy, once you're doing
Right.
work that's meaningful, so that's awesome.
Exactly.
So then you graduated from your MPH and you went on, you said, for a summer ORISE Fellowship at the Office in Smoking and Health at the CDC.
Mm-hmm.
So what kind of stuff did you do in this fellowship?
So that was really brief. I could design my own project as an ORISE Fellowship. And so I used YRBS, Youth Risk
Behavioral survey.
Behavioral survey, yes, and looked at smoking patterns among youth and also dietary practices because, of course, I'm interested in like nutrition. And so I did like a brief study to look at the survey, like secondary data analysis to pull that together. And then I also just supported other work that my mentors were working on. And had the opportunity to present, like at brunch meetings. So it was a good opportunity. It was my first time like working with like some of these national, like larger data sets, which was interesting.
Okay, that's awesome. And how did that play into your next position? Did you have to, was it like, because were both of them ORISE Fellowships or no?
They were both ORISE Fellowships, which I think are a wonderful opportunity and way in the door for anyone who's interested in exploring work at the federal level at CDC. But then also, like I said, I had an ORISE Fellowship at the Army Institute of Public Health. So after that one ended, I was looking for new positions and again, doing some networking at APHA within the ORISE booth. And the recruiter asked, well, like, well, are you interested in like moving possibly? Like, would you consider like moving to Maryland and doing some work for the Army? And so we stayed in contact and she sent me that position for evaluation. And I was like, oh, evaluation is actually an area that I definitely want to explore. From my work in my master's, my teacher was also an evaluator. And I believe she did some consulting work on the side and she just really sold evaluation for me because it's a very particular skill set. And when people are developing programs, they love that part of developing programs, even if they may not have like the skill set to develop the program with objectives and theories, they enjoy that part. But the evaluation part, people don't always enjoy that. So if you like research, and that type of work, it's always going to be like a needed skill set that people, of course, will pay you to do because they either don't want to do it or again, they don't have the experience or the skill set to do so. And so I applied for that ORISE Fellowship and I was granted the position. It was a really like young team. And when I say young, we were all pretty young as in young in our careers. And also the team was just being put together. It was like a new structure within the Army to develop this evaluation team. And so that experience was wonderful because we really got to shape what evaluation would look like for the Army Institute of Public Health. And what does it look like to evaluate these programs and help develop the programs around public health for the Army? And most of that work because it's the Army and so much of the importance or the emphasis is on soldier medical readiness. I got to work on obesity projects and nutrition projects, mental health and mental well-being projects as well. And so that remains like one of my favorite positions, just because I feel like in a short amount of time, I learned like years worth of information about evaluation and gained like years worth of experience in evaluation, just because we were asked and expected to lead evaluation. So that was something that I did. So just a lot of valuable like skills during that time.
Yeah, and that is hugely important. And that's one of the reasons I'm a huge advocate for fellowships, whether that's ORISE Fellowship or any other fellowship, just because they know that you're a new professional into the field, but they're going to give you the type of experiences for you to really hone in on your skills and really build out the skills that you need to be effective. And to that point, you said that you got a lot of program evaluation skills frameworks from your MPH, and now you're like in this role where you have to lead a lot of program evaluation. What was that jump or that disconnect from like what you learned in your MPH to like actually what you had to do in this role? Like how much did you have to learn, or like what was that like for you?
It actually wasn't a huge jump for me. I think my program at Morehouse School of Medicine did a really good job in giving us the foundations of evaluation. We also had projects where we had to partner with an organization and help them in conducting an evaluation. So I had like that experience, like more hands-on experience before I left Morehouse School of Medicine, as well as like experience with like focus groups, interview guides, surveys, etc. But I would say that was the foundation. All of that I built on like tremendously in the Army, because I had the opportunity to learn like new skills in data analysis, which wasn't something that I felt particularly strong in after leaving my MPH program. And so working with my mentor to craft like things that I wanted to improve on and what I wanted to improve on as I led this evaluation. Definitely, we talked about like going through the whole process of developing like your data analysis plan and analyzing your data. There were some other areas that I felt strong, but I was like, okay, I can definitely improve in qualitative analysis. So using in vivo, that was the first time that I used any qualitative analysis software as well. And so again, the foundation was there, but this took me to a new level, of course, because I'm leading. And so I'm also getting those like professional, those soft skills as well, like interpersonal skills. How do you delegate tasks? How do you set timelines and deadlines? And how do you work with a team? So that was a lot of valuable experience, I think, that came with leading evaluations as well.
Okay, well, thank you for sharing that. And I think that is very relevant and helpful to those that are coming behind you. How long were you in this ORISE Fellowship for?
So I was there for about 15 months. I was actually in my second year of the fellowship, and I started feeling like I wanted to go back to Atlanta. I wanted to go back to the CDC. And so after I started my second year, I began to apply for positions back in Atlanta, ORISE Fellowships back in Atlanta at CDC. And it just happened that I got a position really fast. And so shortly after that, I moved back to Atlanta and started another ORISE Fellowship. Later, I became like a contractor, but it started as an ORISE Fellowship, and that was in DHAP, the Division of HIV/AIDS Prevention, particularly in the communications branch. And so I was still doing evaluation, but it was a different type of evaluation. I was evaluating CDC's health communications campaigns for acting against AIDS. And so again, I'm always, or at least at that time, I was always looking for opportunities to add to my skill set. And so I feel like I gained a lot from the Army Institute of Public Health as far as like developing programs, evaluating programs, leading evaluations at all stages, from formative work to summative. But then I thought, wow, like it would be great to be able to add health communications campaigns to my toolbox. And so that was an opportunity that I was excited to take on as well.
Okay. And what was the drive behind you wanting to go back to the CDC for yourself?
It was always my plan to go back to the CDC. At that time, when I ended my brief, like summer-ish fellowship, it was a little bit longer than a summer. I was having trouble finding like opportunities at CDC, new ORISE Fellowships. And so I was talking to my mentors that I had for that first fellowship with OSH, and they were like, don't be afraid to move, like you can always come back. And so I went to Maryland with the idea that within 2 years, and I thought it would be 2 years, I would come back to Atlanta and work at CDC, because ultimately I did want to work at CDC. And so it was just kind of a plan that I had.
Okay, well, thank you for sharing that. And then tell me what was that different skill set that you got from evaluating communication plans?
Yeah, it's the metrics are completely different. I'll say programs and health communication campaigns are just different. And so what I gained was identifying the type of metrics that would be appropriate for measuring health communication campaigns versus measuring programs. And even evaluation, there's always overlap between program development or program implementation and evaluation, which I also love, because you get to do a little bit of both as evaluator. And so with this Office of not Office Smoking and Health, with the DHAP Fellowship on Act Against AIDS, I also learned a lot about developing health communications campaigns. Specifically, we were the research and evaluation team. And so we conducted all of the formative research that went into developing the campaigns, and then we supported the evaluations. So developing, of course, their logic models and their objectives and their evaluation plan, but also how do we test these different aspects of the campaign, from images to the messages? How do we know that this is resonating with the audiences, that we're not potentially like saying things that are harmful or offensive to our audiences as well? So that was an interesting process to learn about as well. I'm like, oh, now I know how to develop health communication campaigns, and I know how to evaluate them as well.
Okay, that is awesome. And yeah, that isn't something that we all think about a lot, or like get that experience in as well. But I think it is very important to understand, as well understanding like program evaluation plays a huge part in like program development and just thinking through, okay, what are we trying, what are the outcomes there, and then looking at like what we are trying to improve and using that to iterate the program and how everything is going there. But so yeah, so I appreciate you sharing that. And how long were you in this ORISE Fellowship for?
So I was in that ORISE Fellowship for 2 years. I stayed there. Well, I will say I was in that position for 2 years because I was transitioned from ORISE Fellowship to a contractor at CDC, but in that same position. So I was in that position for 2 years, and then I left that position to start my PhD program.
Okay. And before you started your PhD program, were you a program analyst at the Research and Evaluation at Chattanooga Government Consulting, or was that's the consulting role that you shifted into?
Yeah, so when I was transitioned from the ORISE Fellowship to Chattanooga, to the contractor, it was with Chattanooga. And my role was program analyst, but technically, I mean, it was evaluation. They just, this generic like term of program analyst, but it was really like evaluation work.
Okay, and tell me a little bit about the logistics of switching over from being like an ORISE fellow to being a consultant for the CDC.
Mm-hmm. So it was a unique situation for me. It was the Chattanooga was I would say every division or branch has like maybe a contractor that they're working with primarily, who like bids and wins a proposal to support staff. And so in my branch, it was Chattanooga. And so they actually just needed to switch me from ORISE to Chattanooga for like administrative purposes. And so that's how I didn't like apply for a new position. They just needed to switch me from ORISE. So that's how I became a contractor.
Okay, awesome. And did you say that during this position is when you started applying for your PhD, or you started your PhD?
It's when I started applying. And so I stayed in that position until I think August of 2014. And so the next week essentially is when I started my PhD at UGA.
Okay, awesome. And then bringing you back to that conversation that you said you were having with your parents, you said that you wanted to get your PhD in public health. Then what was the drive for you wanting to get the PhD in public health, knowing that you like completed your MPH? What was that onus to want to get a PhD?
Again, it went back to skills for me. I felt like there were some additional like skills, particularly around research and evaluation, that I needed that would strengthen like what I brought to the table as an evaluator and enhance my competency as an evaluator, particularly because after I was clear that I was not going to go the MD route, I would stay in public health, potentially PhD, I started thinking a lot about consulting. And I was like, oh, I think again, like this would be an awesome like area to just, even if I was working full time, to have that in like the background, like I could still consult on other projects as an evaluator. And so in thinking through like down the line where I saw my career going, I felt that it was necessary for me to go back to school to get the PhD so I can strengthen my skills in research and methodology, particularly around like evaluation as well. And it worked out for me. I mean, it was like the best decision. At UGA, I also received a qualitative interdisciplinary certificate in qualitative research studies. And I found that to be very valuable because in my public health training, of course, we learn about focus groups, we learn about interviews, but I had no idea that qualitative research was its own field with theories. Like I had no idea. So I was completely blown away at UGA when I took my first like qualitative class. And yeah, I just learned so much getting the qualitative research certificate. They were some of my favorite classes actually during my PhD. So definitely just gained a wide range of like new knowledge surrounding evaluation, surrounding research, and also a lot of skills that I use like every day in the work that I do.
Okay, awesome. And I'm glad that you have like a clear vision for like why you're doing this and what you're trying to get out of it. Because I think a lot of people, or not a lot, some people out there, when they're thinking about PhDs, they don't really have clarity, but they just want to go into it. And I think going into a PhD without any kind of clarity is just setting yourself up for like a spiraling downward trend. So definitely know what you want to do before you get in there. Know what you're trying to achieve from this, because it's not easy. It's not easy. That is for sure.
That is very true. Definitely have a clear reason on why you are getting a PhD, because it takes a lot of work and it takes a lot of time and a lot of sacrifice. So you'll need that. You'll need to have the final goal. You'll need to have that in your mind, like as you're going through all the ups and the downs that a PhD can bring.
Yeah, absolutely. So how did the qualitative certificate work into your coursework? Like, was it that it was separate completely, or did it work actually into like helping you get your PhD?
It was separate. My dissertation was mixed methods, but it's not, the qualitative classes at UGA are not even within the College of Public Health. They're in the College of Education. And so I had my core classes that I was required to take in electives. And then I added the electives from not electives, but the core classes to complete the qualitative certificate.
Okay, awesome. And
so
then,
a lot of classes.
I could only imagine. But you are here now, so we're glad you got through all of them. So during your time at UGA, you were also a graduate research assistant. I'm guessing that is just by happenstance of you being in the PhD program. But what kinds of stuff did you do as a graduate research assistant?
So my research advisor, Dr. Marsha Davis, she's now the Dean of Public Health, College of Public Health at UGA, but she was the head of the Department of Outreach and Engagement, and she was known for community-based research. She had a very large grant in obesity, developing a obesity prevention intervention in elementary schools in Georgia. And so I got to support her projects, of course. And then I had an opportunity to really lead a project with another one of my colleagues and classmates, Dr. Sabrina Cherry, around conducting community health needs assessments. And so that was an opportunity that I think it was a request actually from the hospitals that we worked with, which were in rural parts of Georgia. So under the Affordable Care Act, nonprofit hospitals are required to conduct community health needs assessment, I think every 2 or 3 years.
I think so.
3 years, yeah. And so it's a requirement. And so we came in and we were able to support them in completing a community health needs assessment and providing recommendations for improving the services that they are providing to the community. And for one of those hospitals in particular, Taylor Regional, we won a national economic award for the work that we did with that hospital. And we're credited, I don't even know if it was, it's all due to us, but for helping them to keep the hospital open. And so that's probably one of my best memories. Again, incredible opportunity as a graduate research assistant to be a part of that project, go out into the field and design focus group guides, really applying like everything I was learning in my qualitative classes to this project, conducting the focus groups, designing surveys, conducting the data analysis for the surveys. And then as students, we really got to lead the report writing as well, along with presenting the findings back to the community, working with them to prioritize the recommendations, and then developing the final report for them.
Okay, that's awesome. And that seems like a lot of great work that you're able to do there. And shout out to you for helping Taylor Regional get that award. And I think that's awesome in itself. So I have 2 roles here for you, well, evaluation subcontractor, creative research solutions, and then founder of Black Girls Breastfeeding Club LLC and Birth Work app. This was also during your PhD, correct or no?
Yes.
Okay. So let's start with the evaluation subcontractor, creative research solutions LLC. How do you come across that, and then what do you do in it?
I came across that opportunity actually from a colleague, the same colleague that I worked with on the community health needs assessment as a graduate research assistant. So she knew that I was interested in exploring evaluation consulting. And she had worked with that company as an evaluation consulting or a consultant or contractor. And so she introduced me to that opportunity by introducing me to the presidents, the founders of Creative Research Solution. And I was able to jump right in and work on a number of projects with them, mainly around supporting like qualitative data collection and analysis, which again was really valuable because I'm in the midst of taking all these qualitative courses at the time. And it was also interesting because the founders of the presidents of Creative Research Solutions, their background, I think their PhDs are in education and one is in psychology. And so I was supporting evaluation, but evaluation of like educational initiatives, which again, I love that, like the skills and evaluation are so translatable across different fields. And so you have that opportunity to jump around, evaluate education programs or evaluate health communication program in addition to public health programs. And so that was my experience with them.
Okay, that's awesome. And I just want to highlight also, I didn't bring it up earlier, but like you said that you got a lot of your opportunities, whether that's through APHA or through connections, through people that you already know. And I think that's very important to highlight because, you know, like APHA, I think is very, very valuable in that sense, especially because they're like 15,000 people that go to the conference. Then there are the sections where they have a bunch of people on this email list that you can reach out to. So there's a lot of different ways to connect with people. So I would definitely just advocate for whether it's APHA or another organization, but APHA is like the the foremost public health organization, probably like the biggest reach in the US. So
Exactly.
definitely
Yeah.
tap into those type of opportunities. Okay, awesome. And then you're the founder of Black Girls Breastfeeding Club LLC and Birth Work app. So tell me about the thought process for this. I know that you shared a little bit about your 14-year-old daughter, and that was probably part of the process or the thought process around that, but let's hear more about it.
So when I started Morehouse School of Medicine, my daughter, she was 9 months old, and I was a breastfeeding mom. And as I've mentioned, I've always been particularly interested in nutrition. And I knew that I was going to breastfeed. And then once you become a mom, it just becomes so exciting. At least it was to me. I knew the benefits of breastfeeding. But it was when I was in my MPH program, I was thinking, because at that time, my entire world was revolving around motherhood, that I would do research somewhere in the lines of maternal health and breastfeeding. And so as I was digging into the literature, I started to learn more about the disparities, the breastfeeding disparities that exist for Black women in the US. And it is that Black women are disproportionately affected by a lot of the health outcomes that breastfeeding protects against. And so I became really passionate and also really curious about understanding like why, like what are the barriers, like why do the rates like look like this for Black women? And Black women do breastfeed, I should say that. And the rates increase every year. The rates from a decade ago have increased significantly. But still, according to the recommendations by American Academy of Pediatrics and also the World Health Organization, our rates lag behind those standards that are set to help ensure optimal health and well-being among women and their children as a result of breastfeeding. And so, again, it just became something that I was particularly passionate about as a Black woman, as a mom, and even developed a program while I was at Morehouse School of Medicine, particularly for young mothers who were working on their GEDs at a community college, because we also see that the rates drop among young women as well, teen moms, for example. And so we developed a program with this mini grant opportunity to help educate them on the importance of breastfeeding, but also to discuss like some of the cultural aspects of why the rates look the way they do. What are some of the barriers, historical barriers as well, in hopes that we could encourage and support them in making an informed decision about infant feeding, and that they would have all the tools to continue to do so, even as they finish their GEDs. And so taking that like very early phase of like my interest in breastfeeding, and then it's always something that I knew I would come back to. So when I started my PhD program, it was just a no-brainer for me that I would continue doing breastfeeding research, which, as I mentioned, my master's thesis also focused on breastfeeding. And so in my PhD program, I was learning, again, digging into the literature. At that point, I had something that peaked about like social media. And it was because I had observed in my own breastfeeding experiences these Facebook groups that were popping up with moms like sharing their breastfeeding pictures, celebrating how long they were breastfeeding. And I was like, this is so interesting, but I'm not seeing any research. I see tons of research on like Black women not breastfeeding, and here's why. But here we have these groups with thousands of women in them, and I don't really see any research like understanding like what this phenomenon is and how it's impacting like their breastfeeding experiences. And so with that, again, digging into the literature, learning more about norms and how they influence our behaviors, I decided to start Black Girls Breastfeeding Club as a way to further support Black women in making informed decisions about infant feeding, and also encouraging breastfeeding, of course, and also to help shift the norms that we're still shifting in the way that we want to normalize or renormalize breastfeeding, because it has been something that our community has done for centuries, really renormalizing breastfeeding as something that we do as well. So that's Black Girls Breastfeeding Club. It came at a time where I was just knee deep in the literature as I was like thinking through what my dissertation would focus on and looking at social media. And I have done like a number of workshops on breastfeeding. I do events for moms every year. I partner with other organizations that are larger maternal health organizations like the Black Mama Matter Alliance, all with the purpose of like improving maternal health outcomes for Black women.
So, well, thank you for sharing that. And I think it's important that you highlighted that you were doing this work in your PhD. You realized that this was something that you're like passionate about, as well as you're seeing like this phenomena of like Facebook groups popping up with people talking about their breastfeeding experiences, and you as a researcher digging into that research and understanding, oh, we're not talking about this phenomenon, we're not researching this. This is a gap here, as well as we just need more ways to support Black mothers in breastfeeding, or Black girls in breastfeeding. This is Black Girls Breastfeeding Club. So yeah, I think that's important. I wanted to ask you, so why did you go LLC path as opposed to nonprofit?
You know, honestly, I tell people this all the time. That was like it was just being naive, really. Black Girls Breastfeeding Club functions very much like a nonprofit in hosting events, developing resources. But at the time, one of our earliest initiatives was a t-shirt campaign. Again, I was thinking about health communication, social media, how norms are translated. So we had a t-shirt campaign with moms like saying their t-shirts, which we still have on the site. They say Black Girls Breastfeeding Club, and they were just sharing their stories. And so the purpose was that in seeing and reading these stories about like these women, these moms, these breastfeeding moms, you could see something in yourself that you could relate to or that you inspired to be yourself. And then you could say, oh, well, she's breastfeeding, like, so can I. And so because I was selling the t-shirts, I set Black Girls Breastfeeding Club as an LLC because like, oh, I'm selling things, but it has worked out actually in my favor because Black Girls Breastfeeding Club has expanded at this point, and I do research consulting, I have birth work. And so it's worked out because although I do the community program aspect, there are a lot of like the more business LLC type activities as well.
Yeah, and I just asked that to ask because I see it, and I feel like a lot of people, when they're thinking about especially initiatives around like these types of opportunities, not issues, they're talking, they want to start a nonprofit. And firstly, nonprofits have a lot more barriers to get in than an LLC, and there's a lot other people who can things like that. But I don't think there's like no, unless you really want to get like a lot of grant funding and things like that, there's no like real barrier for you to start an LLC as opposed to a nonprofit. And I think it's just as credible as a path to do good work. And I think I was talking to Marissa McCool, episode 70 something. Check. She was just sharing how we just need, like, we always think about these companies that are getting all this money and stuff like that, but we in public health are doing a lot of the good work, and we just don't have that business knowledge to really capture on that capitalistic approach to things. And I think it's important because we need more public health people empowered in these places where they are able to financially disengage from things and say, okay, I'm good financially, so I'm not going to support this because I know that I'm good without this thing here. And I think it's important that we have these public health people with all these good hearts. For the most part, a lot of our public people have great hearts out here doing this work to really push forward, because I think any business, whether nonprofit or for-profit, it is to help people. And we do a lot of helping in public health.
Exactly. And I think of like what I've created with Black Girls Breastfeeding Club, like I consider myself to be a social entrepreneur. So those are, of course, businesses that are done for social good. And so I love that concept, the concept of like having social enterprise where it is a business, operates like a business, but your purpose is not driven by profit. Your purpose is driven by improving the social conditions of populations.
Yeah, and that's all we pay for, we pay for things that help us. And like whether that's our iPhone or our MacBook computer or whatever, it's something that helps us. And I think we should think about that in the same way in public health for the most part. When not when it comes to things that are keeping people safe and out of like safety net types of things, which are very, very much needed. But I think on a lot of other things, there's opportunities that we don't approach in the best way as public health professionals. But going back to, you said that you started this and now it's expanded. What does that starting and expansion look like?
The first, again, very early activities of Black Girls Breastfeeding Club was a social media campaign on Instagram with the t-shirts and the moms sharing who they were and that they were mothers and how long they had breastfed for. And then I knew that I wanted to do activities as well. So Black Breastfeeding Week is in August, as well as the whole August being dedicated to breastfeeding as Breastfeeding Awareness Month. So doing activities during Black Breastfeeding Week and throughout August was also something that I added on. At that time, I was already doing a lot of guest lectures at UGA, doing guest lectures at Spelman on breastfeeding to different classes. And so I wanted to continue that work. And so that was folded into Breastfeeding Club as well. Over the years, I've expanded to do webinars with different organizations as well. And then more recently, I would say within the last few years, I've developed partnerships with other organizations based on the alignment of the goals of Black Girls Breastfeeding Club and their alignment, which is usually Black maternal health. And so I've been able to work with different organizations, either as a board member or as a kindred partner or collaborator, like with Black Mamas Matter Alliance, and then also consult on different projects that are surrounding research related to Black maternal health. So for example, the project that I spoke about at APHA with the National Birth Equity Collaborative, I was brought into that. Black Girls Breastfeeding Club, the consulting aspect was brought into that project with me leading that research.
Okay, that's really dope. I love that. I love that. And I think it's also cool that you said that you started this to provide this service to people, and now from that, as well as providing this service, has created you as being this expert, which you are in this space where you're able to contract and do work which also supports the other things that are happening in the business, which I think is a good way to think about it as well. And then for the birth work app, what is that about? When did that come into play? And tell me more about that.
I developed birth work in 2020. And again, it goes back to my dissertation research and everything that I was learning at the time about online support, and really furthering my interest in exploring, well, how do we create and use these digital spaces to further support and improve the health outcomes of Black mothers? And so online support, I had already read about research for my dissertation. That is something that Black women are interested in. And so I just had a vision of creating a space that would not only provide opportunities to receive online breastfeeding support, but again, as I'm expanding and doing more work more broadly in Black maternal health as well, a space that would also provide an opportunity for Black women and birthing individuals to prepare for birth, to connect with doulas and other birth workers who we know are very valuable and key support persons, advocacy persons who greatly improve the health outcomes, birth outcomes, and maternal health outcomes of Black women. And so birth work was designed to conveniently connect Black women and birthing individuals to online classes that are taught by Black birth workers. And the classes span anything from preconception to postpartum. So there are classes on childbirth education. There are classes on prenatal breastfeeding education. There are classes on preparing for birthing in a hospital, preparing for home births. And they can either be live classes, they can be group classes, they can be pre-recorded classes. And so you're really able to tailor the information or filter the information to find exactly what you're looking for. Even if you're looking for a birth worker or class or a doula that's in your state, like that's what I'm working to build out, because although these classes are online, maybe you want to have one-on-one in-person contact with a doula after you take your class, so you can even see where they're located on the map. And right now it's in the US, but then there are also 2 providers outside of the US. One is a midwife in in Nigeria, and there's one lactation consultant, nurse midwife, or she's not a lactation consultant yet, working on becoming a lactation consultant. She has some credentials, in lactation, but she's a nurse midwife in Ghana. And so I see this as a global platform where Black women birthing individuals across the world can connect with Black birth workers, again, anywhere spanning their preconception to postpartum health.
Okay, that is awesome, and I'm glad that you're getting expansion into other spaces around the world. How difficult was it for you to build out or create this app?
Initially, I knew that I wanted to do the first part myself, and so I took a class called Apps Without Codes, which helps you to learn the basics of like creating apps without having to use codes, and really also how to develop like an app business. And so I did as much as I could with like developing the initial platform. I spoke to midwives, doulas, lactation consultants, everyone personally, one-on-one, to gauge interest, and also to better discern like what they needed, or better determine what they needed, how and why they would use this platform. So I had all that information that I could use going in to make sure that I'm actually creating something that they would find useful. After that, so recently I was granted grant money from Black Mamas Matter Alliance to further develop the platform in actual app developers who can add the new features that I need.
Okay, that's awesome. And I think it also goes to show like, you're like, okay, I want this app. Let me find out what I can do to learn to at least start this app. And I think when you do that in life in general, if you're trying to build something and you're showing that you're learning and trying to start it, people want to help and support, and it is going to grow from there. So that is awesome. So you said people can find it on the App Store and whatnot like that?
So you can find it, it's web-based now, and you can add it actually as a button on your home screen, but you can find it at www.birthworkapp. So it's bEarthworkapp.com, and you can purchase classes, you can chat with the instructors, but the app developers are, again, adding additional features, and then it'll also be available in the App Store by the end of this year with the work that the app developers are doing.
Awesome.
So I'm really excited about that.
That is very, very exciting. Very, very exciting. Yeah. Where did the name come from? bEarth, or bEarth? It's spelled bEarth, but it's Birthwork app.
Birthwork. Yeah. I was just, so Birthwork is what the app is for. And so we have this term, of course, birth workers, which is used to describe, of course, doulas, midwives, lactation professionals. So all of these individuals who support every aspect of birth. So I wanted to play on like the word birth work, because that's what this app was created to support. And then just had the idea of changing the language to earth. Thinking of Black women as representations of like birthing the earth and all that we bring to the world. And so I changed the spelling up a little bit from BIRTH to BEARTH.
Yeah, awesome. I love the creativity. What advice would you give to someone if they were interested in starting, whether that's a LLC or a nonprofit business around anything, I guess, that they're interested in? What advice would you give them?
I would say be very clear about your goals, activities, like the purpose of your business. That's where I started, thinking through like my story, what I hope to accomplish. And again, mine functions like more of a social enterprise. And so it's not just solely like a consulting business or anything like that. So I thought through more of those nuanced things like what are the activities, what is the purpose, like what are the goals that I'm trying to meet within this business. And then I would say also just traditionally having a business plan is really helpful. Just so you can have all of those details like really ironed out and really clear. If you are looking for grants, because right now there are a lot of opportunities for grants for small businesses to expand, like it definitely helps to have your business plan so you can really articulate like what it is you are trying to do, what the gap in the market that your business is fulfilling, and also ideas around like expansion and growth as well.
Awesome. Well, thank you for sharing that and great insights for anyone that might be thinking about doing that type of work. Were there any big wins that you wanted to share before we move on to your current position?
I would say for birth work, definitely getting funding from Black Mamas Matter Alliance, because that has allowed me to, of course, develop or to hire the developers and adding some really cool features to birth work. And I'm very excited about this next level. So been able to explore in the phase of like developing partnerships or exploring partnerships with medical institutions and clinics, which is something that I'm excited about as well. So there are a lot of things happening with birth work. And again, I encourage anyone who's looking for classes to check out the site now. They're up and they're running. And also just to keep in touch, if you go to the site, you can, of course, submit your email information and stay in the know of all the updates and expansions that will be happening over the next few months with birth work.
Awesome, awesome. And I will leave a link to that in the description as well as the show notes, so you can be sure to check that out. And where can people find more information around Black Girls Breastfeeding Club?
So the Black Girls Breastfeeding Club website is www.blackgirlsbreastfeedingclub.com. And even with Black Girls Breastfeeding Club, I've been excited to just grow in the space of like breastfeeding knowledge and breastfeeding expertise. And so I've had some really cool opportunities, invitations to present for different summits and organizations. So it's definitely, I feel like I'm operating within like my gifts and my passion. And so that, of course, is always exciting when things start coming together and just growing in general.
Okay, it's awesome. And I look forward to seeing the continued growth of both Black Girls Breastfeeding Club and the Birth Work app. And definitely check that out if that's something you're interested in. I know that I have quite a few people who are interested in like maternal and child health type stuff. So look, you have a resource right here in front of you. So reach out to Dr. Ayanna Robinson if you want to connect and just learn more or try to get tapped into that type of work as well. So thank you for sharing that. That was very much appreciated. And then your current role, you are a program evaluator at the Centers for Disease Control and Prevention. So how did you come across this, and what do you do in it?
I came across this opportunity shortly after I graduated with my PhD in 2018. It was an opportunity that multiple people sent to me. And ironically, at the time, I had accepted another position. And I was like, oh my gosh, like if I get this one, I just remember thinking I'll have to figure out a way to like rescind my acceptance because this job, it's perfect. And so the position in my current role is I'm the project evaluator for the overdose response strategy pilot projects. And this is, again, I've been serving in this role since 2018. We're actually gearing up for the 4th year of pilot projects. And ultimately it was created for public health and public safety to collaborate in developing programs and initiatives to prevent fatal and non-fatal overdoses. And so we have had any range from 5 pilots to in my first year in the role to 8 pilots in this 3rd year that just passed. And they are all doing innovative projects surrounding post-overdose outreach, overdose education in the lock zone, training in jails, And again, they're all working with public safety, typically law enforcement, but also EMS and other law enforcement areas to develop these initiatives and also to implement them as well. So as the evaluator, I provide evaluation technical assistance across the pilots, also serve in the project officer role, where for about half of the pilots, I'm also the person who's like the key support in developing, making sure that their deliverables are clear. But as the evaluator, again, I support the evaluation through technical assistance. I develop all of their evaluation deliverables, like the evaluation plan. I help them develop in their logic models. It's been really fun for me because in other experiences at the CDC, you don't always get to work so closely. Of course, people think of CDC is up here, and then they fund initiatives. And so there's usually like a very light touch. But because of the nature of these projects, I actually get to work very closely with them, even as far as being able to help them in conducting like interviews, developing their tools if they need that type of assistance. So yeah, it's been fortunate because I like that type of hands-on work, and I've been able to do that.
Yeah, and that is fascinating, because when you were talking about the role, I was thinking, okay, you're evaluating on like the CDC side of things, but it seems like you're more on the community side and helping them do the evaluation, which is awesome. For those pilot projects that have passed, is that the data and the findings that you all have, is that available publicly or no?
It's not available publicly. We share it within CDC and with our other pilot projects. However, we are working on like a special journal, and I'm blanking right now actually on the journal, but a special edition that will completely cover public safety, public health collaborations in overdose prevention. And so a number of not only the pilots that I work on, but in my team, their public health and public safety projects will be featured in that journal. So there will be some dissemination more widely within the next year, because of course, our goals are to see what we can take from the pilots that we can scale up and replicate to other communities within the ORISE states, but then also to disseminate that work so other institutions and communities can have the information as well.
Yeah, I'm putting my hand up. I definitely want that information. So I'll be looking out for that report, because I do work in substance misuse. And I think you all are probably learning a lot of important things and good takeaways. So I appreciate that work, and I look forward to the reports that come out afterwards.
There is a CDC document. If you Google, and I'm blanking on the exact title, but if you Google like CDC strategies in overdose prevention, anything like that, there's a book that came out of my division, which is Division of Overdose Prevention, that was developed by my branch chief and other individuals who were supporting projects in the branch at the time. And it covers like concepts like post-overdose outreach, I believe, and academic detailing, naloxone education and distribution. So all of these like promising practices. And a lot of the pilots actually use that book as guidance for their activities and the type of pilot projects that they're developing.
Okay, awesome. Thank you. Well, I will definitely check out the Purple Book and look out to read that. And if I'll also add it to the show notes for anyone that is interested in checking that out as well. And I also wanted to highlight that you said that a bunch, like you got into this a role, and then a bunch of people sent you this other role. And I think that's very important to also highlight. You need people in your court that are going to be advocating for you, who are going to be putting opportunities in your lap and saying, hey, you'd be a good fit for this. And that speaks to your network. So awesome stuff there as well.
Yeah, I feel like that has been a theme in job opportunities. It's so important that, having connections, even putting yourself out there, like at conferences, letting it be known, especially if you're early in your career, you're looking for fellowships, you're trying to gain a particular skill set. Put yourself out there, go to these conferences and other network events so people know that when an opportunity comes up and it may fit your skill set or your interest, that they can reach out to you. I think that's really key. But just in continuing even through this position, letting people know like, hey, I just graduated. They all know that I'm looking for evaluation work. I'm looking at CDC. And so again, multiple people sent that opportunity to me just because they knew that I was looking for jobs at CDC and specifically evaluation positions.
Yep, absolutely. Let the world know what you're looking for, and it will more likely come your way.
Yes.
Awesome. So before I move you on to the Furious Five, the 5 questions I ask all the guests, I would like to ask you, where would you like to see yourself in the future?
I love that question. So in the future, I see myself most definitely still working in evaluation. And I have 2 goals, I guess I would say. I would love to do more leadership work at CDC in evaluation. CDC has a whole office of director of evaluation that really oversees like evaluation fellows and the work there. And then if my trajectory shifts me away from CDC, I still see myself ultimately in leadership roles in evaluation. So director of research and evaluation is ultimately where I would like to be. I would love to, of course, be doing that work specifically for maternal health. That is my passion area. And so I've even increased the amount of work that I do now with maternal health, which I feel very fortunate to have, to be able to do both at this point. And then, of course, with the work that I'm doing with birth work, I plan for birth work to be like the place where Black women and birthing individuals all over the world can come and find information online. And so continuing to grow like those businesses is definitely where I see myself in the future.
Awesome. Thank you. And we look forward to following the journey to wherever it is you do get to, but definitely a director of research and evaluation or learning or whatever the case might be in the future. It's in the cards. It's in the cards for you.
Thank you.
You're most welcome. So moving you on to the Furious Five, 5 questions I ask all guests. Number 1, what advice would you give to a student trying to pursue a career in public health?
So one thing that I think I've carried over throughout this interview is taking advantage of all the opportunities that come your way, especially in this early stage of your career where you're really trying to figure out what you want to do. Take advantage of those opportunities. I would not be where I am today if I hadn't made room for those pivots. So oh, well, this is an opportunity. Let me see where this leads. And it's so fascinating to me because I can look back now and I can connect the dots and see how all of these different opportunities led me to where I am. So absolutely put yourself out there, have those informational interviews, and again, just take advantage of different opportunities to explore public health. It's so broad. There's so much that you can do, but really find out what you like to do within public health. And you can't do that unless you're really taking advantage of opportunities.
Absolutely. Number 2, if you're talking to someone wanting to get into your position, what advice would you give them?
Oh, I love that. So if you're a public health student and you are interested in evaluation, make sure that you're taking some foundational courses in evaluation within your public health programs. That is where I learned the most. Even in my PhD program, if you're in a PhD program, I took evaluation courses there as well. And I continue to build upon those skills. So I think that coursework is really important. If you are not in school and you're interested in evaluation, because sometimes people ask me about evaluation and they're beyond school at this point. There are so many opportunities to learn about evaluation. So Claremont University in California, they have evaluation courses, evaluation certificates. There are great evaluation books, anything by Patton, I would suggest. So again, getting those evaluation skills is going to be really important. And then if you're just trying to get your feet wet in evaluation, there are organizations that you can support. American Evaluation Association, if you're in Atlanta, there is an Atlanta chapter. There are opportunities to volunteer and support nonprofits in evaluation. ORISE Fellowships, again, that's a good way to get your feet wet. There's a CDC Evaluation Fellowship. So I think if you're earlier in the process, building those skills and then starting off with some volunteer or fellowship opportunities, that'll help you.
Awesome. That's some great advice. So thank you. Number 3, what's something you are working on improving in your life right
I am working on improving, not taking on so many opportunities. That is always something that I personally just have to work at. I love having I love like doing different things, and I feel like I'm a multi-passionate person. And so I always have these big ideas. But what I'm also learning is every big idea doesn't have to be implemented at the same time. So writing down my ideas, putting them on the timeline, focusing on one thing at a time. It's never one thing at a time for me, but focusing, I would say, on just like a few things at a time that I can do really well and execute really well. And then not taking on so many opportunities that it takes away from like personal life, I would say. Or even like the quality that I can be committing to these other things that I'm really passionate about.
Absolutely. Makes sense. Number 4, professionally, do you recommend anything? And I feel like you dropped like a bunch of great professional development things that you said earlier around like evaluation. So if you want to just say those things again, or like, I don't know, maybe some advice someone gave you, if there's anything that stands out.
So some advice that I received, if you are, I have a few tidbits. If you're pursuing like a PhD, for example, I think most people who are like in PhD programs or graduate schools, like you tend to be overachievers. And what I was always told during my graduate school experience was the best dissertation is a done dissertation. PhD dissertation is not supposed to be like the height of your career, but use that as a stepping stone to where you'd like to go next in your research. And don't be completely consumed with perfectionism that you spend more time on dissertations or any projects really, even in work, than what you need to. Yeah, perfectionism can be a terrible a terrible time waster, really. And so, yeah, definitely in a PhD program, best dissertation is a done dissertation. And then something else I was also told before I started, when I was still at CDC, by my supervisor, I was exploring programs and I was considering this really expensive school that had a lot of work in breastfeeding. And I had a full ride from UGA. And she told me, like, you are going to school to get skills. Like, if you want to learn about this topic, read a book. She's like, you want to be an evaluator? Like, you are going to school to get skills. And so that always stuck with me as well. And I really did craft my PhD curriculum around gaining as much skills as I could as possible.
I love that. And I think that is very, very relevant, especially in today's world with so much information out there to get like knowledge around things. But yeah, skills are a lot harder to gain than knowledge is. So yeah, great advice. And then last but not least, where can people connect with you?
Instagram. So my Black Girls Breastfeeding Club page is also at Black Girls Breastfeeding Club on Instagram. We're working on the birthwork separate page, but right now, even birthwork, all of that is integrated, I would say, into the Black Girls Breastfeeding Club. You can send me an email. I love like talking to people, especially about career advice. And so if you have like additional questions, or if you're interested in any of the work that I'm doing, you can send me an email at blackgirlsbreastfeedingclub@gmail.com. Or if it's specifically about birthwork, you can send an email to info@birthwork.com. And again, birth is BEARTH.
Okay, awesome. And I will definitely add those to the show notes. And I greatly appreciate you coming on and sharing your story and sharing all your insights today. I enjoyed this conversation thoroughly.
Thank you so much for having me. Yes, I enjoyed it as well. It was great speaking with you.
Yeah, awesome. And we'll definitely stay connected, that's for sure. And I wish you luck going forward. Housekeeping items, everyone. Thank you all for listening or watching this. Be sure to subscribe if you haven't subscribed as yet. Make sure to leave a review, to leave a like if you're watching this on YouTube. Share it with a friend. And if you'd like to support, you can go to buymeacoffee.com/thephmillennial or the phmillennial.com/support and find out different ways to support there. But thank you all for listening, and I will see you all next week.